Hello there. So, see, you're here for a checkup, and just to let you know, I'm a student doctor today for Dr. Sarah. So she's going to be showing me a couple of things. So hopefully you don't mind me just sort of stand back and watch and maybe do a couple of quick checkups on you, whatever she gets me to do. Okay, so before we get started, she's just off right now, just going over her files a bit, but she shouldn't be too long. But I just have a couple of quick questions just to make sure that I have the right chart. So can you tell me your first and last name? And how about your date of birth? And don't be ashamed, but how about your weight and your height? Perfect. Yep, that's exactly what we have here. So just to tell you what we're going to do today, Dr. Sarah is going to come in and she's going to check your vitals. Let's have a quick look at, listen to your heart, your blood pressure, and then she's going to check your lymph nodes just to make sure those are doing well. And then she's going to have a quick look inside your mouth. And then she's going to check your ears and your hearing just to make sure that that's all in top shape. And then she's going to just do a quick ocular check, just check your eyes, make sure that they're working well. And then finally, she's going to do a bit of a dermatological exam and just look at your skin and make sure that everything's going well and fine there, all right? Okay, well, hopefully she should be here any second now.
Hello, how are you today? Good, good. Well, as my student Eddie has explained, I'm just going to start this by doing a little check of your blood pressure and your heart and your lungs, if that's okay. Great, okay, so you just relax there. All right. I'll just get some gloves on.
I'm going to put some gloves on too.
Yeah. You've had no recent infections? Okay, that's fine. And we've got your medication, haven't we? We've got the medication list.
Yeah.
So that's fine, so we know what we're dealing with. Okay. So, I just want you to take some nice deep breaths for me. So, in and out. Okay, so in and out, get nice and relaxed, okay? And I'm just going to pop the stethoscope onto your chest, okay? Okay, can you take a breath in and hold it for me? That's great, and breathe out. Okay, and one more time, breathe in and out. Okay, that's great. So, I need to check your blood pressure. Do you have any preference to which arm? No? Okay, that's fine. So, I just need to put the cuff onto your arm, okay? And I'll put the stethoscope onto your pulse on your arm, and then I'll inflate the cuff, okay? It will feel a little bit tight, but it shouldn't be too uncomfortable, and it doesn't take long, okay? So you just relax. I'll use your left arm here. Okay, so let's just get that on there. And I'll just pop the stethoscope into the crease of your arm and just inflate the cuff. So it was 122/80, if you'd like to write that down, which is really healthy. So we're happy with that. So I'm just going to remove the cuff. Okay. And okay. I just want you to breathe in a little bit for me in some nice deep breaths, and I'll just check around the back, okay? Just listen to your lungs, okay? So 1 big breath in and out. Okay, that's fine. And round this side and in and out. Perfect. We're all done with that now. Okay. So you've said you've not had any recent infections, so I wouldn't be expecting to find any swollen lymph nodes, but it's always good to check. Okay, so can you just relax there for me? I'm just going to check the lymph nodes down your neck, okay, behind your ears and across your collarbone. Okay. So have you observed this? Mm-hmm. Have you done this before?
Yes, but not recently.
Okay. So just very gently, just down the neck. Okay. Mm-hmm. And just behind the ears there. You're not feeling any pain or pressure? No, that's good. Okay. Okay, that's fine. And then just across clavicle there. Mm-hmm. Okay, so
do you sometimes check the underarms or not for this exam?
Yeah, we can check the underarms. Are you happy for me to check under your arms? Yeah, okay. So just raise your left arm for me. So you have to put a little bit of pressure in when doing it, okay? So you're just pressing the different areas. Mm-hmm. There's several lymph nodes in that area. Okay. And that's fine. And then I'll just come over to your right arm and just raise that for me. Thank you. Okay, that's fine. Thank you. So nothing was found there, which is all good and healthy. Okay. So you don't suffer with any throat problems? No? Okay. So I'd just like you to just open your mouth for me, pop out your tongue and say, oh, and I'll just have a look around into the back of your throat there. Okay. So nice and wide for me. Great. And ah. Okay, let's have a look in there. Okay. And again. Okay, that looks great. Can you just pop your tongue to the side of your mouth for me? That's great. And this side. Okay, that's fine. And what I'd normally do at this point is I would check the temporomandibular joint just by asking them to open the mouth. Mm-hmm. Okay, so I'm just going to put a little bit of pressure on your jaw there, and I want you to just open and close that jaw for me. Okay, and open wide. Lovely. And close. And one more time. That's great. So there was no clicking, no unusual sounds there, and no pain. No, that's fine. So that's all healthy. It's just you make a note of that. Should be good. Okay. So the next part, I'm just going to take a little look in your ears. That's okay. I'll be using this otoscope. I'll gently insert it into your ear. I'll pull the ear up and back, and I'll be able to have a look down the ear canal to make sure there's no redness, no inflammation, no fluid behind the eardrum, or any unnecessary wax build-up. Okay? Alright. So just coming round, and I'm just going to pull your ear up and back and gently put the otoscope into the ear. And just visualising the ear canal, which has no redness, that's fine. only a small amount of earwax, which is perfectly normal. And the eardrum is not bulging, it's not wrinkled, and the structures behind the eardrum are all visible, and there's no fluid bubbles at all. So that is a perfectly healthy ear canal and eardrum. Okay, so would you like to just have a look to see what a perfectly healthy eardrum looks like?
Putting your back, putting it in gently. Oh yeah, I see. Yeah, that's very healthy eardrum.
Very healthy. Yeah. So would you like to check the other side,
sure,
and then I'll see what you're doing? Are you comfortable there? Good. Eddie has done this many times, by the way, so you're in good hands.
So there, very little earwax buildup. The eardrum looks fine. There is a bit of red inflammation just over on the side. You might want to just have a quick peek at it. It could be nothing.
Okay.
So, there you go.
I'll just have a little look and check that. Okay, just want to pull the ear up and back and just insert. Okay. Yep, there's a slight bit of redness. Have you been putting Q-tips into your ears? You have? Okay. I think that's what's irritated the ear canal. It's close to the external part of the ear. It doesn't look like it's an infection, but it's definitely red. Okay, but that's not anything to worry about, but keep those Q-tips out of your ears for a while. Alright, because we shouldn't be putting those down our ears anyway. But absolutely fine further down the tympanic membrane, the eardrum is perfectly fine. Okay, so just withdraw that now. Alright. So that's fine. Okay.
Did you want me to administer a hearing test?
Yes, that's a good idea actually.
Okay. So I'm going to whisper a series of numbers into each of your ears a couple of times, and I just want you to repeat those back to me. All right? Okay. 0, 3, 4. 7, 9, 2. 2, 0, 1. 3, 4, 1. 0, 0, 7. 3, 9, 3. Perfect. Yeah.
Okay, all good. So everything seems fine with your ears. Just a little bit of redness on this side. Okay, but that's nothing to worry about, and we wouldn't need to. No, we wouldn't need to treat that. Okay. So next, I'm going to take a little peek into your eyes, just to make sure that the muscles in the eyes are working as they should. Okay, and also that your pupillary reaction is working as it should too. So we'll check the pupillary reaction first. Okay. So I'm just going to have this little light, and I'm just going to quickly bring it across from side to side just to see how those pupils react. Okay, are you comfortable? This won't hurt at all. Okay, so just flick that in there. Okay, and this side. And just one more time. Okay, that's fine. So what did you see there?
I saw the pupils dilate when you shine the light in, they constricted.
Yep, so they're working perfectly fine, which is good. And for the next parts, I'm just going to check that the ocular muscles are working fine. So I'm just going to ask you to look directly ahead. Okay, you don't need to move your head. You just need to move your eyes and follow the light as I move up and down and across. Okay, so remember to keep your head perfectly still. Okay, do let me know if anything is uncomfortable. Okay, so I'll start there and we'll go up and down. That's right, just follow the light with your eyes. Okay, and we'll go to the right and to the left. Okay, and we'll go across and down, across and down, and across and down, across and down. Can you just look up for me? Okay. Okay. Just check around the eye there. Okay. Okay, can you just look down for me? Okay, that's fine. And one more time, just look to your right. Okay, and to your left. Okay, everything seems fine there, no problems. So you're happy with everything so far? You're feeling comfortable? Okay, that's good. Always check with your patient that they're comfortable. As we go along. So we'd like to take a look at your skin. Have you had any skin problems? Okay. So you do get a little bit of dryness now and again. Okay. Has it been treated before? Okay. All right. That's fine. So I'm going to cleanse your skin with a very gentle wipe. Just to remove any debris that you may have picked up on your journey here. Okay, these are very, very soft on your skin. Okay, so I'm just going to start there. Okay, and just down, cheek there. Feels nice and cool, doesn't it? Yeah. Okay. Okay. That's fine. There. I think we're all good.
I can put that in the reviews.
Okay, thank you. So first things first, I'll just have a little manual check, just a little press around to make sure that there's no lumps and bumps on your face, okay? There's no visual lumps and bumps there, okay, but it's just worth just to have a little press. There's nothing I can feel. Okay, just down. Nose area there, and just the chin. Okay, that's fine. So I'm going to take a closer look now with the magnifying glass, just to take a good look at the condition of your skin and to look closely for any signs of damage. Okay. Just relax there, okay. Just come around a little bit there. Okay. And take a look at this. Can you see that there?
Yeah, it's like a little mole, but
Okay.
there's no irregular borders.
That's
It's
correct.
round. I think it's fine. Yeah.
It is. So there's just a little mole, but it is, as Eddie said, just a.
It's like a freckle.
Yeah, it's more like a large freckle, but it's fine. There's no irregular borders. There's no redness. There's nothing unusual about it. I'm sure you know it's there, so that's fine. Can you see those areas of redness just around there? But that's just dry skin, and that's easily corrected.
Moisturizing cream.
Just a nice moisturizing cream.
Mm-hmm.
That's all you need. Nothing too harsh. Okay, so that seems fine. Let's just have another check of like elasticity there. So I'm just gonna go around. Okay, can you just do a smile for me? That's good. Okay, that's fine. Well, I'm happy with that. I can't see anything unusual there.
Mm-hmm.
So just a little bit of moisturiser on these little red dry patches, and that will be good to go. If it starts to itch or spread more, then obviously, you know, we can get that checked for you. But at the moment, I think it's just a case of moisturising, okay? Because there's no other indications that it would need something stronger, like a steroid. It just looks a little bit dry. Okay.
That's good.
All right. So we're happy with everything here, aren't we?
Yeah, I think we're done here.
Do you have any questions? No. Okay. So we'd like to thank you for coming to see us today.
And thanks for allowing me to stay and watch this.
Yeah. And you'll soon be graduating as a doctor, won't you?
Soon.
Soon, very soon. Okay, so I wish you a good day. Take care.
Bye-bye.
Bye-bye.